Part 4 of the video series is on documenting the physical assessment intervention within the nursing student role. In this module, we're going to discuss how you will document your physical assessment on your patient. As you look through the intervention list, you will note that there is no physical assessment available for you as a student because we have set up a separate intervention to allow for the cosigning on the physical assessment. So what you will need to do is actually add an intervention that relates to a physical assessment by a student. So the way you do that is you come down to the bottom buttons and you click on Add Intervention. And in the search line up here, you're going to start typing student. And you'll find one called Physical Assessment by Student Nurse. You're going to put a check mark next to it, and then you're going to come down and add and close. You will notice it's at the bottom of the interventions list. It's in purple, meaning you need to save it. So you're going to come over here and click the Save button. And when you scroll down, you will find Physical Assessment by Student Nurse. Now, our physical assessments are set up in a bundle using all the different systems that you would do with a head-to-toe assessment. Since we're just going to be documenting on that one item, we're going to highlight it, and you can again either click Document or double-click on it. I'm going to just choose Document this time. We're going to go ahead and say this is our 12 o'clock assessment, and say OK. And then you'll notice we have a go-to list that includes all 7 of the systems that we do require for assessment. So we're going to start with the cardiovascular assessment by clicking on that. And when this screen opens, at the top is a first query you must answer. And the query will generally for you be about whether the patient meets a defined norm or meets defined norm except. That means you've done your head-to-toe assessment, you've collected all the data involved, and you can see that as you scroll down here what cardiovascular would include. You would then chart if it does not meet or if it does meet the defined norm. So what's the defined norm? Well, it's right here defined. So as you look at your data, is this describing your patient? If it is, then you would check meets defined norm and you would not chart any further. Just for today, so you can have an example of it, we're going to say that your patient meets defined norms except 1, 2, 3 items. We'll just kind of put our data in and I'll show you that. So the patient doesn't meet all of this. So then we're going to chart just what they don't meet. If it's within these defined norms, you don't have to chart it because it meets defined norms except. We'll talk about focused assessment a little later. So her cardiac rhythm is fine, but she is tachycardic. So we're going to note that. Normal rhythm would not be any of these things, and it is defined here, so we don't chart that. We get to heart sounds. Again, she has normal heart sounds, so we're not going to chart that. Now we get to pulses. The number of pulses you check is patient dependent, but just like cap refill and perfusion. And so I'm going to show you in cap refill what you would do to add if you needed to add extra pulses. But her pulses are all 2+. However, when you do her cap refill, her finger and her foot are both 2 to 3 seconds. And if you look at our normal up here, normal is less than 2 seconds in all 4 extremities. So what we're going to chart on are the 2 areas where it's not less than 2 seconds. We're going to start with her hands, and bilaterally her upper extremities have a cap refill of 3 seconds. I want to talk about lower extremities, and it's different than while I'm in this occurrence somewhere in these 3 different areas. I come down to the bottom and I insert an occurrence. That gives me a second cap refill of occurrence, and this time it's going to be the left lower extremity only. The right's okay. And this cap refill is 4 seconds. I'm going to say okay. Now, clinically, this is not making a lot of sense, but just so you can see how you chart. Then if you needed to do all 4 extremities or whatever, you could. Be very careful though when you add occurrences because it does slow down the loading of the screen. You would do perfusion the same way. It may in fact be that your perfusion on the left lower extremity, it's not as good, but that's the only one. So we're going to say left foot is pale and cool. The other ones are all warm and pink and all that still. But that one's not looking too good. Again, you can use a second, a third, and a fourth. All of the other circulatory issues are within normal limits. There is no edema. What did you do? Well, I notified the bedside RN, and then whatever else would have been done. So let's go to, and let's now do the respiratory assessment. Phil has asthma, so he's not meeting defined norms here either. And here's our defined norms. His airway is fine, though. It meets the defined norms. He is tachypnic. He has some nasal flaring. He's using accessory muscles to breathe. And there's some upper airway congestion. Expansion is fine. Pattern is fine. He is retracting substernally, subcostally, and it is mild to moderate. So that's saying both of those locations are mild to moderate. But if substernal was moderate and subcostal was mild, we would want to link a note. And let's do that. Instead of clicking mild to moderate, I'm also going to click Other See Notes. And I'm going to come down here to the bottom where it says Link Notes. Don't use the Notes button over here. Those notes are free floating. By linking it when you're in a screen, you can actually find them after you save them. So I'm going to click on Link Notes, and we're going to find this screen that comes up. We're going to go down to where the free text is, and we're going to start our note by saying what we're talking about. So retractions, mild subcostal and moderate substernal. You could continue on whatever you needed. You could add other topics, like maybe I want to talk about the breath sounds further or something. I would start that line by breath sounds. Now, it's off of the screen on this view, but you're going to click the Save button, and your prompt will come up to save that note. Once you save your note and have it co-signed, you will be back where we left off. Our patient has an intermittent, tight, non-productive cough. You don't have to deal with crepitus. Now, someone has already charted on our patient earlier with auscultation, and what you're seeing here are the modifiers for location. So if you click the pluses next to it, you will see that they charted bilateral middle lower lobe separate from upper lobes, meaning the breath sounds were probably different, and you should have gotten that in your report. But when you listen to him, you're hearing wheezes throughout. We only need the first occurrence, and as I noted on cardiovascular assessment, if you leave occurrences on when you don't need them, it will slow the system down. So let's go ahead and get rid of the second occurrence. Now, everything that was charted earlier will not be lost. So with one of the three queries in the second occurrence highlighted, we're going to come down here and click Discontinue Occurrence. What was charted is still saved. It's just we don't have it on the screen to slow down the loading. Now, when we get back up here, we want to say that it's throughout. It's not just middle and lower lobe. So we want to clear this out, and we're going to use the same button, but the first occurrence never goes away. So we're going to discontinue occurrence, and now we have all the choices back. We're going to say bilateral, throughout, or you could click upper, lower, middle, however you want to do it. Expiratory wheezes. He has a tight but non-productive cough, so we don't need to do the sputum. He is receiving continuous oxygen, and there is an oxygen therapy assessment intervention that you would be documenting on. As part of our interventions, we may be repositioned. We might have notified the bedside RN, who might have notified the RCP, or you might have notified the RCP if they were there, and they may have actually done a breathing treatment with a medication. So that's how you would use this bottom part of it. So we finished respiratory, so we're going to go to our go-to. We're now going to do neuromuscular assessment. And as we did our head-to-toe for this, data we found met the defined norms. So you checked all of these items. They all met defined norms. So you just have to click meets defined norms, and you don't have to chart anything because this is what you saw when you did your full assessment. Now it's saying you want to go to the next part of the go-to list, which is GI assessment. So it's a shortcut. We don't have to click go-to. We say yes. Here's our GI assessment. We look at the definition, but if you remember when we did our pain assessment, there was some guarding in the left upper quadrant. That's it. There's nothing else that applies. So we're going to say meets defined norms except, and we're going to say left upper quadrant, there's some guarding and some tenderness when we palpated, if you remember. Bowel sounds are still normal active. We didn't check the liver. This is fine. So is this. All the rest of this is fine. So we probably let the RN know about that. And now we're going to go to the GU assessment, met defined norms. So we're going to say that. And now it's saying you've got to go to integumentary. So we're going to do our head to toe skin assessment. And I'll talk about how you document that in a minute. But I also said I would talk about focused assessment. If you check focused assessment, that means you did not do a full system assessment of whatever system you're in, whether that's cardiovascular, respiratory, whatever, and you're just charting on one item. That would be a little hard to come up with an idea of when you might do that for cardiac, respiratory, neuro, because you'd want to do a full head-to-toe assessment if anything was out of normal. But you might do it in skin if you simply had one area, say an IV infiltrate, that you're documenting every half hour. Then you would call that a focused assessment because you didn't look at all the skin. So that's pretty rare. I wouldn't worry about that. Most of the time you're doing full system assessment. So you're using either meets or meets except. So we're going to say meets except because we've seen the birthmark. That is really the only thing for our child. So we don't need to chart any of this general information because it meets defined norms. So we have occurrence number 1. It's right midline neck birthmark. There's 1. The skin is warm, smooth, and intact. No dressing, no drainage, no odor. It's still 1 sonometer by 3.5. And the rest of this really applies to a wound or a pressure injury. And there's really no interventions we would do. We're going to go ahead and say we've charted, and we're going to go to. And psychosocial is the last one. Again, there's a defined norm. And if you look down here, you have a lot of different ways to describe and interventions to do. Say our patient meets defined norm. We're now going to go to. We've charted everything. We don't feel like we need to go back and chart anything. We're going to click save, and there's your trigger for a cosine.